So intermuscular haematoma means that the bleeding spreads, so it's not confined within an area. So often what we find is the muscle bleeds between, the bleeding occurs between the muscle fascia and the adjacent blood vessels. So the fascia is the outer casing or lining of the muscle, and the vessels. Okay, and after an initial increase, bleeding usually spreads, but then once the bleeding spread, the pressure decreases. So typically what you'll get is bruising and swelling caused by that collection of blood that sort of appears and disperses to the edge of the muscle. So it often looks more superficial. However, we can get deeper versions where the blood is kind of on the outside but also in the inner part of the muscle. And what happens is that the appearance of it changes within 24 to 48 hours. So what happens is, because gravity brings the blood to the surface, you will see a discoloration of the skin, and often we'll see some reduction in movement. Okay, so we don't have much movement within the 24 to 48 hours, but after that we find that movement comes back quite quickly, unlike the intramuscular haematoma. So the kinds of treatment we would be looking to do is, in the initial stages, encouraging rest. You can bandage and compress the hematoma in the initial stages to try and compress the bleeding, so you limit how much bleeding takes place. You then look to cool the affected area to limit the pain. One common thing is to elevate the limb, so that actually you're trying to get the fluids to move away from that area. This kind of recovery often happens quite quickly, so you're looking at recovery within 48 to 72 hours. You're looking at increased range of movement at the area, and after that you're looking probably within 2 to 3 weeks for a full recovery. I would expect a full recovery within 2 weeks, really, depending on how severe the intermuscular haematoma is. So very different to the intra. The intra is a lot longer in terms of its recovery. This one, because the bleeding is not confined and seeps away, it's a lot easier to remove the fluids and get a quicker recovery time.